Hello, everyone. You're listening to Health Professional Radio. I'm your host for today, Tabetha Moreto. Our guest today is Professor Peter O'Sullivan from the School of Physiotherapy and Exercise Science at Curtin University. He is a specialist physiotherapist who has developed a management approach for disabling chronic lower back pain called cognitive functional therapy. We'll also be talking about National Pain Week, which is being held in Australia. With all that said, welcome to the show, Peter. I'm so happy you can join us today.
Thank you very much.
So, Peter, can you explain why is lower back pain so common with people?
Yeah, it's a great question. The latest research is showing that that back pain is experienced by almost all human beings at some point in their life. So about 80% of people will have some form of back pain. And this emerges really early in life. So even at the age of 14, about 45% of young people have reported having had back pain, and that increases towards about 70% and that's pretty close to adult rates. Now, the thing that is of greatest concern is that for a small group of people around, and that varies between somewhere between 10 and 30%, back pain becomes disabling. That means it stops them from, it impacts on their ability to work, go to school, participate in daily activities, involve themselves in social activities, sport, etc. And so that's where the burden lies in terms of the disability impact. And back pain has been shown to be the leading cause of disability of all health disorders in the world. So it's a huge issue.
Yes, I understand it is a very huge issue.
Yeah.
Okay, so Peter, why does back pain, lower back pain especially, become chronic and disabling for some people and for others not so much?
Yeah, it's a great question, and this is something that our group has been greatly involved in, and we've been part of a population cohort study which has tracked the development of pain, and particularly back pain, in a group of adolescents into adulthood. We've looked at the factors that influence back pain, and particularly what lead to disabling back pain. And the kinds of things that historically people thought were important for back pain, like your joints are too mobile, or your core's weak, or your posture's not good, or there's something damaged in your back, don't show up to be strong predictors. The things that influence whether you become disabled or not are things more like your history of pain and how you responded to it, how you learn to manage pain in a family environment. So if your parent has responded to pain by avoiding activity and taking time off work, as a child you're more likely to develop those habits of responding to pain by either avoiding or by protecting your body. And what we see is that negative things like negative beliefs, that if you believe back pain is linked to damage and you have to protect it and avoid stuff, then those beliefs drive behavior, and those behaviors end up driving what we would call disability. So you're more likely to take time off school because you're worried that back pain is a sign of threat or some kind of damage to your body, and therefore you want to protect it. So the things that we're seeing drive disability are not so much things around the structure of the back. They're much more linked to how you perceive your pain, how you respond to your pain, and your emotional response to your pain. So if you worry about your pain, if you become fearful of your pain, that tends to cause a wind-up in the nervous system, sensitize your nervous system, and lead to more disabling patterns of behavior.
I see. Very fascinating information. So, Peter, can you tell me what are the common beliefs or even misconceptions regarding lower back pain you want to clear up?
Yeah, absolutely. So we've also been involved in research looking at beliefs in both adolescents and in adult populations, and other researchers around the world have as well. And the most common beliefs about back pain is that back pain, people believe that if you have back pain, there's something damaged to your back or you've had some kind of injury, even though what you see in an MRI scan correlates really poorly with how much pain you feel and how much disability you have. But those are very common beliefs. The other belief that people have is that back pain means you need to rest, which is probably the worst thing you can do for back pain. People believe that if you've got back pain, it's likely to get worse with age, which is not true. We know that back pain actually tends to reduce in later life. We see that people with back pain think you've got to sit up straight, protect your back and brace your core, where in actual fact, if we look at people with back pain, they're more tense and protective than people without back pain. We have these beliefs that, there's something out in your back, and this is often reinforced by common messages by health professionals who tell you that there's something else needs to be put back in, and there's no evidence for that. There's a belief that if you do a movement or an activity that causes pain, it's going to do harm to you, or in actual fact, physical activity and movement is one of the best things you can do for your back. So there are really strong beliefs out there that reinforce this kind of view that back pain is a threat and you need to protect it and it could lead to disability. And unfortunately, those beliefs are often beliefs of healthcare practitioners as well as societal beliefs. And they hugely reinforce healthcare behaviours as well as people's disability behaviours.
Wow, that's amazing, Peter. Thank you so much for clearing up those misconceptions. Even myself, I believed in those misconceptions before where when someone...
common.
Yes. To tell you the truth, Peter, I myself had suffered from back pain in the past, and that's the first thing doctors would tell me is take a rest, don't move too much, and things like that. So thank you so much for clearing up those misconceptions.
That's fine. It's such an important message to get out.
Yes, I agree with you.
And I think the problem with that, what you highlight, is when you're told that, it makes you frightened. And when you're frightened, you protect the area of pain, and that in itself becomes a driver of pain and disability. So a lot of our therapies are really designed to break down those myths, build people's confidence to get back to moving, functioning normally and living again.
Peter, so are there any specific activities that people need to temporarily or permanently stop in order to avoid back pain, like in my case?
Yeah, so it really comes down to the history. So one of the first things you have to do as a health professional, if someone presents to you with pain, is to make sure you rule out anything that's potentially serious. For about 1% of people with back pain, it could be caused by some other cause, something serious like a malignancy or an infection or a fracture. But those things are predicted by things like a history of malignancy, in IV drug use for infection, or in the case of a fracture, with some kind of trauma. So once you've ruled those things out, and as long as you don't have any neurological deficit, that is a loss of power and sensation, and there's no sign of nerve compression, they don't cause pain, but that would cause like a neurological deficit. Then for the majority of back pain, then we separate it into, is this been a traumatic event, like an ankle sprain, that where you would just modify your movements for a couple of days and then gradually get back to normal levels of function? Or in many cases, back pain is triggered by things like stress or not enough sleep or a period of inactivity or fluctuations in mood. So if you have a period where you're really down or you're really stressed or become very anxious or have some kind of external social stressor, that can present itself in pain. And in that context, the worst thing you can do is to rest and protect your back. So we would first differentiate between the kinds of potential mechanisms associated with your pain. For the majority of people, back pain is not linked to injury, and in those cases, we would take a careful history, examine the person, give them strategies to relax their body, get them moving, facilitate them to get back to the things they love in a graduated way where they feel safe.
Okay, very interesting information. All right, Peter, so let's discuss now about cognitive functional therapy. So can you explain how can this particular therapy ease back pain?
Yeah, so if you understand that a lot of back pain and disability is impacted by your thoughts, your behaviours and your emotional responses. So that might be, I've got back pain, my back's damaged, therefore I'll protect it and avoid stuff, and that creates fear. That creates a wind-up in the system. So cognitive functional therapy directly targets those factors. So it's cognitive in terms of developing an understanding for the person that the triggers that are associated with their back pain. So, for example, I saw a lady just 2 days ago who'd had 25 years of disabling back pain, who believed that her pain was linked to damage. Now, showing her that actually, and she developed these protective behaviours that made her pain worse. So actually demonstrating to her that relaxing her back and moving normally actually reduces her pain. And then educating her that actually her pain is not linked to damage at the spine, it's linked to the fear of doing damage. And then taking her back to the things that she loves and wants to do, which is to go for a walk on the beach and ride a horse and engage with her friends and her family and physical activity. That's a journey that we take people through. And what it does, it builds people's confidence up, and actually you'll see significant pain reductions as they start gaining confidence and gaining function. So it's about unraveling that combination of factors around negative beliefs and fear and disability, where we actually replace that with positive beliefs, confidence, and normalizing the way people use their body and taking them back to the things that they love.
Wow, that's very fascinating, Peter. Can you tell me, do you know how many Australians are suffering from chronic pain, such as lower back pain?
Well, you could work it out by the population. So we know about 30% of the adult population. We know, for example, for, say, teenagers or adolescents, for people with back pain with a degree of disability, it's around 20 to 30%. Around for adults, it's around the 30% mark. So depending on how you measure disability, it would vary slightly, but you're dealing with about 1 in 3 of the population who have some degree of pain and disability. And this is not just about back pain. This kind of idea of understanding pain is now showing to be the case for all kinds of pain problems like neck pain, even arthritic pain in later life, that these things like beliefs and behaviours look like really important factors for people with, say, NEO-A, not just what you see in a scan. So it's a really big issue.
Well, thank you so much, Peter, for sharing that information. Now let's talk about the special event that you have called National Pain Week. So can you tell our listeners what's so special about National Pain Week?
Yeah, so this is something that's it's an initiative to bring a spotlight on pain. And part of that is because if you look at health problems like diabetes, heart disease, cancer, pain, the problem of pain and disabling pain or chronic pain is bigger than all of those put together. But we only receive funding. If you look at research into pain, less than 1% of health funding goes to researching pain. And so understanding pain is often very stigmatized in society. You know, we kind of stigmatize people with pain and disabling or chronic pain as weak or, you know, that there's something, you know, weak about that person. But actually we understand that pain can be extraordinarily disabling and it can disrupt all aspects of someone's life. So both from a societal level and from a health funding level, and even within the medical system, pain is not being managed well, and it's not understood well. And some of these myths around pain that are really strong in society that I've already talked about need to be confronted, and the public needs to be educated about them, because those myths really leave people trapped in a process of disability and often depression. Where pain starts impacting on their lives in a very negative way. So the National Pain Week is a means of saying we need to talk about pain, we need to understand pain, we need to educate society about the latest knowledge about pain, that actually these are things, pain is something that can be managed well, that disability is not something that you need to, you know, if you're disabled with pain, there are ways of managing pain to get your life back. And these are very important positive health messages in a climate, a medical climate, where the disability burden of pain is getting worse. And, you know, ironically, the more surgery that's been done, the more we drug pain, you know, this escalation of opioid use, for example, for pain hasn't made the problem better. It's actually made it worse. So building people's capacity to take control of their health and find ways to manage pain in a way that means that they feel in control of something really, really important.
Wow, that's very fascinating information. Okay, so now, Peter, what is your main takeaway message to all our listeners?
Yeah, so if you're a healthcare practitioner, don't frighten people with pain, number one. Be really clear about the evidence of what it means and what it doesn't, so that you don't feed negative beliefs and fear in your client. And so that comes back to examining our own health beliefs. If you're someone with pain, then there are some wonderful resources that you can go to first up. And we have, there's a website called Pain Health, which has been developed by colleagues of mine, which is a West Australian health website, which is a fantastic resource for people with pain to go to just understand some of these things around pain. We also have another website called Pain Ed, which is, a website both for health professionals and for people with pain. The second thing is, if you have pain, make sure that you rule out serious stuff, but then the most important thing is that you don't fear it, that you learn to find the things that trigger it and then learn to control them. And if you're struggling to control them, then work with someone who understands the contemporary research around pain, so you can actually develop a strategy of getting your life back. That would be the kind of key messages that I would say are very important.
Fantastic. All right, so for our last question today, what's the best way to contact you guys, or how can people get involved with National Pain Week?
Yeah, so we're obviously contactable through our website. So I'm both a practicing clinician. I work at a practice called Body Logic Physiotherapy in Perth, Western Australia, and also through Curtin University website. Then we can be contacted through there. Also through our pain website, which is pained.com. So all of those websites will have capacity to be in contact with us. Pain Australia is a group that has been involved in the coordination of the initiative for Pain Week as well.
Okay, thank you so much, Peter, for your time. I really appreciate it, and this was a very interesting topic today.
Great. Thanks for the opportunity to share this with you.
Okay, and that was Professor Peter O'Sullivan from the Curtin University of Physiotherapy and Exercise Science. We've just been talking about the problems associated with lower back pain, and we also discussed about cognitive functional therapy and National Pain Week. If you like this interview, transcripts and archives are available at www.hpr.fm. We're also on all major social media platforms, so don't forget to follow, like, and subscribe. We're also available for download on SoundCloud and iTunes. I'm Tabetha Moreto, and you're listening to Health Professional Radio.